14 signs. Your liver is full of fat. Have you ever felt extreme fatigue that doesn't go away, even after a good night's sleep? Or perhaps persistent abdominal pain that seems inexplicable? How about an itch on your skin with no apparent reason? If you answered yes to any of these questions, your liver might be trying to send an alert. In this video, we will explore the 14 main signs that your liver might be in trouble. Did you know that identifying these signs early can be crucial in preventing more serious complications? Stay with us until the end, as we will teach you how to reverse fatty liver in weeks and reveal sign number 13, which few people can identify but is the most dangerous. You will be surprised. Let's get started. Sign 1. Excessive fatigue. One of the first signs that something is wrong with your liver is feeling extreme fatigue. You might feel tired beyond what seems related to the amount of physical activity you've done. This happens because an overloaded liver reduces your energy levels, leaving you feeling constantly tired and drained. This type of fatigue does not improve with rest and can affect your daily activities, lowering your quality of life. Besides feeling tired, you may notice that you're getting out of breath more quickly, even during light activities. This occurs because a compromised liver cannot adequately process toxins and nutrients, affecting the body's energy production. If you're feeling this way, it's important to consider the possibility that your liver is at risk and seek medical advice for a proper diagnosis. Excessive fatigue can be an initial symptom of fatty liver, but is often ignored or attributed to other factors like stress or lack of sleep. Therefore, if you're experiencing persistent and unexplained fatigue, observe other signs mentioned in this video and consider getting a medical checkup. Sign 2. Abdominal pain. Pain or discomfort in the upper right part of the abdomen can indicate liver problems. This area is where the liver is located, and the presence of fat in the liver can cause inflammation, resulting in pain or discomfort. The pain can range from mild to intense, and can sometimes be mistaken for gastrointestinal issues. This pain is usually continuous and may worsen after eating fatty meals or consuming alcohol. Besides the pain, you may also feel a sense of fullness or pressure in the abdominal area. In some cases, the pain may radiate to the right shoulder or back, increasing the discomfort. If you feel unexplained pain in this region, it's crucial to consider the possibility that your liver is at risk. Consulting a doctor is essential to determine the exact cause of the pain and start appropriate treatment if necessary. Imaging tests, such as an ultrasound or CT scan, may be recommended to assess liver health and identify the presence of fat or other abnormalities. Sign 3. Abdominal bloating. Another common symptom is abdominal bloating. This can occur due to the accumulation of fluids in the abdomen, a problem known as ascites. Ascites can be a sign that the liver is not functioning properly, leading to fluid buildup in the body. This bloating can cause discomfort and even difficulty breathing in more severe cases. Additionally, abdominal bloating can be accompanied by unexplained weight gain or a feeling of pressure in the abdominal area. If your abdomen is bloated and you don't know why, consult a doctor to investigate your liver's health. Early detection is essential for effectively treating fatty liver and preventing more serious complications. Abdominal bloating can also cause a feeling of fullness or distension, even after small meals. In some cases, ascites may be visible as a bulge in the lower abdomen, especially when lying down. To diagnose ascites, your doctor may perform a physical exam and order imaging tests like an ultrasound or CT scan. In some cases, draining the accumulated fluid may be necessary to relieve discomfort and conduct laboratory tests to determine the underlying cause. Sign 4. Loss of appetite. Loss of appetite, especially when accompanied by nausea, can be an alert. When the liver is full of fat, it can affect digestion and metabolism, leading to loss of appetite. This change in appetite can result in insufficient intake of essential nutrients, affecting your overall health. If you notice a sudden change in your desire to eat, pay attention to other symptoms that may indicate liver problems. Loss of appetite can be subtle at first, but it's important not to ignore it, especially if it's persistent. Lack of appetite can lead to involuntary weight loss and weakness, exacerbating other symptoms of liver dysfunction. Besides loss of appetite, you may feel early satiety, where you feel full quickly after eating small amounts of food. This can be accompanied by nausea and, in some cases, vomiting. These changes in appetite and digestion can significantly affect the quality of life and nutritional health. Consulting a doctor can help identify the underlying cause and ensure your liver and other organs are functioning correctly. Your doctor may recommend blood tests and imaging tests to evaluate liver function and identify the presence of fatty liver. Sign 5. Unexplained weight loss. Losing weight without an apparent reason is another sign that your liver may be full of fat. Poor liver function can lead to weight loss because it plays a crucial role in metabolism and nutrient absorption. When the liver is compromised, the body may not be able to process food properly, leading to involuntary weight loss. If you're losing weight without trying, it could be a cause for concern. It's important to monitor other changes in your body and consult a doctor for detailed exams. Detecting liver problems early can help prevent more serious complications and improve your overall health. Besides weight loss, you may notice a decrease in muscle mass and strength, which can affect your ability to perform daily activities. Unexplained weight loss can be accompanied by other symptoms of liver dysfunction, such as fatigue, loss of appetite, and abdominal discomfort. To diagnose the cause of weight loss, your doctor may perform blood tests to evaluate liver function and identify nutritional deficiencies. Imaging tests, like an ultrasound or CT scan, can also be used to visualize the liver and detect the presence of fat or other abnormalities. Sign 6. Jaundice. Jaundice, or yellowing of the skin and eyes, is a clear sign of liver problems. This happens when there is an accumulation of bilirubin in the blood, a yellow pigment produced by the liver. When the liver cannot process bilirubin properly, it accumulates in the blood and causes jaundice. This sign is visible and usually indicates that the liver is seriously compromised. Besides yellowing skin and eyes, jaundice can be accompanied by dark urine and pale stools. Improperly processed bilirubin by the liver can also cause intense itching of the skin, known as pruritus. This itching can be generalized and persistent, causing significant discomfort. Jaundice can be caused by various liver conditions, including hepatitis, cirrhosis, and bile duct obstruction. If you notice these symptoms, it's essential to seek medical help immediately. Blood tests can measure bilirubin levels and evaluate liver function, while imaging tests like an ultrasound or MRI can identify abnormalities in the liver and bile ducts. Treatment for jaundice depends on the underlying cause. It may include medications to reduce liver inflammation, procedures to unblock the bile ducts, or lifestyle changes to improve liver function. In severe cases, a liver transplant may be necessary. Sign 7. Dark urine. Dark-colored urine can indicate that something is wrong with your liver. As with jaundice, the presence of excess bilirubin can darken the urine. If your urine is darker than usual and you're not dehydrated, consider investigating your liver's health. Changes in urine color can be an early sign that the liver is overloaded and not filtering toxins from the body properly. Besides color, the urine may have a stronger smell. If you notice these changes, it's important to consult a doctor to perform blood tests and other tests that can identify liver problems. Early detection of liver dysfunction can help start appropriate treatment and prevent more serious complications. Other conditions that can cause dark urine include dehydration, urinary tract infections, and kidney disease. However, if the color change is accompanied by other liver-related symptoms, such as jaundice or abdominal pain, it is even more important to consider liver health. Your doctor may recommend urine tests to analyze the presence of bilirubin and other compounds. Imaging tests, like an ultrasound, can be used to evaluate liver structure and identify possible abnormalities. In some cases, a liver biopsy may be necessary to determine the severity of the problem. Sign 8. Pale stools. Pale or light-colored stools can be another symptom to watch for. The liver produces bile, which aids in digestion and gives stool its color. When the liver is not functioning properly, bile production can be affected, resulting in pale stools. This is a warning sign that should not be ignored, as it can indicate bile duct obstruction or other liver dysfunctions. If you notice that your stools are consistently pale, consult a doctor. Early detection of liver problems is crucial to start appropriate treatment and avoid serious complications. Also, observe other symptoms such as abdominal pain or jaundice, which may be associated with this condition. Bile is essential for fat digestion and absorption of fat-soluble vitamins. When bile production or flow is interrupted, stools can become light or whitish. This interruption can be caused by diseases like hepatitis, cirrhosis, or bile duct stones. To diagnose the cause of pale stools, your doctor may perform blood tests to evaluate liver function and measure bilirubin and liver enzyme levels. Imaging tests, like an ultrasound, kinetic scan, or MRI, can be used to visualize the liver and bile ducts and identify possible obstructions or abnormalities. In some cases, a liver biopsy may be necessary to determine the extent of liver dysfunction. Treatment will depend on the underlying cause and may include medications, procedures to remove obstructions, or lifestyle changes to improve liver function. Sign 9. Itchy skin. Persistent itching can result from the buildup of toxins in the body due to poor liver function. When the liver cannot properly filter toxins, they can accumulate in the skin, causing itching. This itching can be generalized or localized and usually does not respond well to conventional topical treatments. If you're suffering from persistent itching without an apparent cause, it may be related to the liver. Itching can be accompanied by other liver symptoms, such as jaundice or excessive fatigue. Consulting a doctor for tests and liver tests is essential to determine the cause of the itching and start appropriate treatment. Pruritus associated with liver problems can be very intense and affect sleep quality and the ability to perform daily activities. In some cases, itching may be more intense on the palms of the hands and soles of the feet, but can occur anywhere on the body. To diagnose the cause of itching, your doctor may perform blood tests to evaluate liver function and measure bilirubin levels. Imaging tests, such as an ultrasound, can be used to visualize the liver and detect possible abnormalities. In some cases, a liver biopsy may be necessary to determine the extent of liver dysfunction. Treatment for liver-related itching may include medications to reduce bilirubin levels in the blood, as well as lifestyle changes to improve liver function. In severe cases, a liver transplant may be necessary. Sign 10. Mental confusion. Difficulty concentrating and mental confusion can be signs that your liver is overloaded. The liver plays an important role in removing toxins from the blood. When it is not functioning properly, these toxins can accumulate and affect the brain, leading to mental confusion and memory problems. This symptom is known as hepatic encephalopathy and can vary from mild to severe. Besides confusion, you may experience mood changes, irritability, and difficulty performing daily tasks. This is a serious symptom that should be treated urgently. Consulting a doctor and undergoing liver tests can help identify the cause of mental confusion and allow appropriate treatment to restore normal brain function. Hepatic encephalopathy can be caused by various liver conditions, including cirrhosis and hepatitis. Other associated symptoms may include excessive sleepiness, difficulty concentrating, and hand tremors. In severe cases, it can lead to a coma. To diagnose hepatic encephalopathy, your doctor may perform blood tests to measure ammonia and other toxin levels in the blood. Imaging tests, such as a CT scan or MRI, can be used to evaluate the liver structure and identify possible abnormalities. Treatment for hepatic encephalopathy may include medications to reduce ammonia levels in the blood, as well as dietary changes to limit protein intake. In severe cases, a liver transplant may be necessary. Sign 11. Easy bruising. If you notice that you're bruising or bleeding more easily, it can be a warning sign. The liver is responsible for producing proteins that help blood clot. When the liver is compromised, the production of these proteins can be affected, resulting in easy bruising and frequent bruises. Besides bleeding gums, nose, and small cuts, you may also notice large bruises that appear without an apparent reason. If you have these symptoms, it's important to consult a doctor to evaluate your liver's health. Blood tests can detect clotting problems and help identify liver dysfunctions. Easy bruising may be accompanied by other symptoms of liver problems, such as fatigue, jaundice, and abdominal swelling. These symptoms indicate that the liver is not functioning properly and needs immediate medical attention. To diagnose the cause of easy bruising, your doctor may perform blood tests to evaluate platelet levels and clotting factors. Imaging tests, such as an ultrasound, can be used to visualize the liver and detect possible abnormalities. In some cases, a liver biopsy may be necessary to determine the extent of liver dysfunction. Treatment for liver-related clotting problems may include medications to improve blood clotting, as well as lifestyle changes to improve liver function. In severe cases, a liver transplant may be necessary. Sign 12. Swelling in legs and ankles. Fluid accumulation in the legs and ankles can also be related to fatty liver. This is known as edema and can occur when the liver is not functioning properly, leading to fluid buildup in the lower extremities. The swelling can be uncomfortable and even painful, making it difficult to move and perform daily activities. Besides the legs and ankles, edema can affect other parts of the body, such as the abdomen. If you notice persistent swelling in your legs or ankles, it's important to investigate the cause with a doctor. Early diagnosis of liver problems can help treat edema and improve liver function, preventing more serious complications. Swelling in the legs and ankles may be accompanied by other symptoms of liver dysfunction, such as jaundice, abdominal pain, and fatigue. These symptoms indicate that the liver is not functioning properly and needs immediate medical attention. To diagnose the cause of edema, your doctor may perform blood tests to evaluate liver function and measure protein levels in the blood. Imaging tests, such as an ultrasound, can be used to visualize the liver and detect possible abnormalities. In some cases, a liver biopsy may be necessary to determine the extent of liver dysfunction. Treatment for liver-related edema may include diuretic medications to reduce fluid buildup, as well as dietary changes to reduce salt intake. In severe cases, a liver transplant may be necessary. Sign 13. Bad breath. Persistent bad breath, even with good oral hygiene, can be a sign of liver problems. This occurs because the liver helps remove toxins from the body, and when it is not functioning properly, these toxins can accumulate and cause bad breath. Liver-related bad breath usually has a characteristic odor, often described as sweet or moldy. Besides bad breath, it can be accompanied by a metallic taste in the mouth. If you're dealing with bad breath without an apparent cause, consider the health of your liver. Consulting a doctor can help identify the underlying cause and start necessary treatment. Early detection and treatment of liver problems can improve your overall health and quality of life. Other conditions that can cause bad breath include gum disease, respiratory infections, and digestive problems. However, if bad breath persists and is accompanied by other symptoms of liver dysfunction, such as jaundice or abdominal swelling, it is even more important to consider liver health. Your doctor may recommend blood tests to evaluate liver function and measure toxin levels in the blood. Imaging tests, such as an ultrasound or CT scan, can be used to visualize the liver and detect possible abnormalities. In some cases, a liver biopsy may be necessary to determine the extent of liver dysfunction. Sign 14. Daytime drowsiness. Feeling excessively sleepy during the day can indicate an overloaded liver that cannot perform its functions correctly. Daytime drowsiness can be caused by the liver's inability to properly process toxins, affecting your energy and leading to constant fatigue. This symptom can be easily ignored, but it's important to pay attention if it is persistent and affecting your daily productivity. Besides drowsiness, you may have difficulty concentrating and a constant need to take naps. If you're experiencing these symptoms, it's important to investigate your liver's health with a doctor. Tests and liver tests can identify underlying problems and allow appropriate treatment to restore your energy and well-being. Daytime drowsiness may be accompanied by other symptoms of liver dysfunction, such as mental confusion, loss of appetite, and abdominal swelling. These symptoms indicate that the liver is not functioning properly and needs immediate medical attention. To diagnose the cause of daytime drowsiness, your doctor may perform blood tests to evaluate liver function and measure toxin levels in the blood. Imaging tests, such as an ultrasound or CT scan, can be used to visualize the liver and detect possible abnormalities. In some cases, a liver biopsy may be necessary to determine the extent of liver dysfunction. Treatment for liver-related daytime drowsiness may include dietary changes, increased physical activity, and medications to improve liver function. In severe cases, a liver transplant may be necessary. What to do to reverse fatty liver? If you've identified some of the signs we mentioned, don't despair. Fatty liver is a reversible condition, and with some lifestyle changes, you can significantly improve your liver's health. Here are some important strategies. Adopt a healthy diet. Nutrition plays a crucial role in liver health. Opt for a diet rich in fruits, vegetables, legumes, whole grains, and lean proteins. Reduce the intake of processed foods, sugars, and saturated fats. Foods rich in fiber, such as oats, apples, and carrots, help improve liver function. Exercise regularly. Regular physical activity is essential to reduce fatty liver. Try to include at least 30 minutes of aerobic exercise, such as walking, running, or cycling, into your daily routine. Exercise helps burn fat, including fat stored in the liver. Control your body weight. Maintaining a healthy weight is essential for liver health. Gradual weight loss can significantly reduce fatty liver. Avoid drastic diets and focus on sustainable weight loss through balanced eating and regular exercise. Avoid alcohol. Alcohol consumption can aggravate fatty liver. Limit or eliminate alcohol consumption to allow the liver to recover and function properly. Monitor medication use. Some medications can overload the liver. Always follow medical guidelines and inform your doctor about all medications and supplements you are taking. Medical follow-up. Have regular exams to monitor your liver's health. Medical follow-up is essential to evaluate the condition's progress and adjust the treatment as needed. By following these guidelines, you can help reverse fatty liver and improve your overall health. Remember, lifestyle changes can have a significant and positive impact on liver function. If you've identified any of these signs, consult a doctor. And if you found this video helpful, don't forget to like, share, and subscribe to the channel for more health tips. This helps us continue to bring relevant and informative content to you. Thank you for watching, and see you in the next video.